video number 2 of the Head Posture Analysis and Structural Restoration series. In video number 1, we discussed the physiologic compromise that occurs when patients present with forward head posture, and we understood the statistics and the research supporting that we need more posture experts out there who are confident and certain in their ability of correcting forward head posture and other head postural distortion patterns. Now in video number 2, we're going to be discussing postural imaging and head posture analysis in order to make structural restoration recommendations to your patients. So let's get to the content of video number 2. At the American Posture Institute, we are committed to providing you with the knowledge necessary to grow your practice by focusing on patient-centered, expert-level posture correction care. Our goal is to fast-track you to success so you have more certainty in your doctor-patient communication, your clinical assessments, and demonstrate clinical precision in your treatment protocols that all objectively measured with predictable correction results. In this video, I will give you insight of how to analyze posture images for head posture distortion patterns. We will specifically cover how to determine the Burns cervical angle for forward head posture, and the lateral flexion angle to determine the dominant side of lateral flexion. This will give you good insight of what you will learn in the Head Posture Analysis and Structural Restoration online course. As Dr. Bryan said after taking the course, learning how to analyze posture imaging completely changed the quality of care I provide to my patients. Plus, my patients love seeing their progress throughout their treatment plan. Posture imaging is the utilization of posture analysis software to analyze for posture distortion patterns of the posture system. The research indicates that postural imaging is more effective than visual analysis of posture angles. Fortin et al. In 2011 compares clinical measurements for postural analyses in terms of efficiency and clinical accuracy. According to Fortin et al., posture photos are the best way to objectively analyze posture. When posture images are taken accurately, they provide the posture expert with the information they need to make appropriate clinical decisions. From posture images, posture angles can be measured, and posture experts can objectively evaluate the postural presentation. Posture images are very inexpensive and they raise no threat whatsoever to the patient. You can take a posture image pre- and post-treatment to identify immediate changes. With the complete posture correction protocol, it's expected to see immediate changes in postural design. At this point, we understand why posture images are important and how we can utilize them for safe referrals in our offices. Now let's get clinical. Let's discuss how to analyze posture images for head posture distortion patterns. When analyzing cervical x-rays for head posture analysis, to determine forward head posture, you would evaluate the craniovertebral angle. To determine the craniovertebral angle, it is the angle formed by a horizontal line drawn through the spinous process of the 7th cervical vertebra and a line joining the spinous process of C7 vertebra with the tragus of the ear. You then measure the angle. The smaller the angle, the more advanced the forward head posture is. If there is not a red flag indicating the need to do cervical spinal x-rays, such as suspicion of fracture following a trauma or pathology, you can evaluate for the presence of forward head posture and other head posture distortions by analyzing a posture image. To evaluate the degree of forward head posture, you can utilize the Burns cervical angle. To measure the Burns cervical angle, you draw a horizontal line from the level of C7 vertebra. Connect this line with a vertical line starting from the posterior aspect of the vertebra through the external auditory meatus. Again, the smaller the angle, the further advanced the forward head posture presentation is. You can see the lines on the slide here. You can draw the lines directly on your posture images. And then from the anterior view of the posture image, you can measure which side, if any, has dominant lateral flexion via the lateral flexion angle. How to do this? So a point is placed in the middle of the eyes and in the center of the chin. A second set of points are placed one in the episternal notch and one in the center of the neck and below the chin. A line is drawn from each set of points, the head being drawn inferiorly and the neck superiorly. Where these lines intersect is the lateral flexion angle. This will determine the side and degree of lateral head flexion. Compare the angles from right to left. The side with the smaller angle has dominant lateral flexion. Also evaluate which side has shoulder superiority. More commonly, but not always, the level of the shoulder superiority will be found on the side of dominant head tilt or lateral flexion. By evaluating the posture images for these two angles, the posture expert has important information necessary to make accurate clinical predictions and a treatment plan with objective outcome measures. After evaluating for forward head posture via the Burns cervical angle and the side of dominant lateral flexion via the lateral flexion angle, you can make an educated decision about the necessary treatment plan for the patient. If forward head posture distortion patterns are noted from the posture image, the goal of treatment is to reverse the noted postural distortions via reverse postural rehabilitation strategies. If you want to learn everything you need to know about analyzing head posture and structural restoration techniques, we've created an advanced course for you. Your patients deserve expert-level care. This course will make you the expert in analyzing posture images for head posture distortion patterns and will provide very specific, proven, evidence-based correction strategies. Our goal is to fast-track you to success. The best way to grow your practice is to provide superior, predictable clinical results. Eliminate the guesswork and become competent in this correction. You can't get results if you don't have a proper clinical analysis. Objective results start with a clinically precise exam. As I know that you are committed to clinical precision in your practice, I want to offer you the course Head Posture Analysis and Structural Restoration for a special price of just $149. But you must act fast to get this price point. The course will go back to the original price of $475 on Sunday, December 20th. If you take advantage of this special offer, you will also get $500 worth of bonuses completely free. These bonuses were designed to give you everything you need to implement the information from the course into your practice. We give you patient handouts with all of the reverse posture exercises on them. The work is done for you. You simply hand the patient the handout with how to complete each of the exercises. This will save you time as a doctor and make patient compliance much easier for your patients. You will also get head posture analysis forms so you can easily record the findings from the posture images. We want your clinical exam to be very accurate, but also efficient. This form makes it quick and easy for you to record the findings right away. And a cheat sheet of how to perform each of the head posture angles. Although we only covered 2 angles today, there are many others you will learn in the course. To perform an efficient clinical analysis, you can use the cheat sheet to check your work and learn the angles. Plus, a research resource guide demonstrating the physiologic effects of forward head posture. This research guide provides evidence for what you are doing as a posture expert and why it is pertinent that patients with forward head posture seek corrective care. And a video demonstrating how you can implement all of this into your clinic for under $100. You don't need to spend a fortune to get better clinical results. At API, we've got you covered. The Head Posture Analysis and Structural Restoration course provides modern concepts that you can complete in just a few hours from the comfort of your own home. Buy it today and start implementing the strategies right away. At API, we always say that your success is our priority, which is why we've created this advanced course and $500 worth of bonuses, because we want you to be successful. Forward head posture is an epidemic, and there's no one more qualified than you to step up and be the expert in your community. We wish you a Merry Christmas from the American Posture Institute and encourage you to take advantage of this special deal before Sunday, December 20th. Thanks, docs, and as always, remember, it's posture by design, not by circumstance.